it's the afternoon, but this is just, I don't know, I think it's interesting stuff. So vitamins and supplements are kind of a strange category of things, and it's a big catch-all. So I want to talk about the processes behind how they're approved and that stuff a little bit first, just so we understand that. And then I'll talk about some of the more common ones that are used. Of course, the sky's the limit with this stuff. So, and then you get into really, you blur the line into nutrition too, which I'm not really going to touch on at all because that gets all people all kinds of worked up. And anyway, so you've got dietitians to talk about that kind of stuff. All right, so I'll just give the caveat that I'm not anti-vitamin supplement, but I am anti doing things that don't work and doing stuff that's not necessary. So that's where I'm coming from. For example, like if you don't need to take any pharmaceutical drugs, that's great. I love that. Don't do that. But same thing with vitamins and supplements. Like a lot of these don't have any evidence, and the bodies of evidence for this stuff is so incredibly weak. The amount of stuff people put into their bodies and spend on it is mind-boggling to me a little bit. But anyway, that's my perspective coming into this. So let's talk about the regulation side of things, and I'm not going to try and convince you otherwise if you like your vitamins, but let's talk about some of this stuff. So what is the definition of a dietary supplement? It's a product intended to supplement the diet. It contains one of the following ingredients: a vitamin, a mineral, an herb, or other botanical or amino acid to supplement the diet by increasing total intake. So in other words, something that we maybe are getting deficient in because we aren't eating enough of it, or something that is maybe a naturally occurring thing with the herbal or botanical component there. That's what it is. But that definition is really vague, right? That could encompass basically anything. Herbs and botanicals, as far as definition goes, a botanical is plant-related, right? Herbs are kind of a subset of botanicals. Ideally, an herbal product is going to be a more pure version of something that was isolated from a plant, but that's not always the case. And that doesn't always really match the definition of a dietary supplement either. I mean, herbs and botanicals are kind of listed in there, but it doesn't really mean you need to... A dietary supplement defines that, yes, but if you think about the maybe... common sense idea of a dietary supplement, do you need to supplement your body with ginseng? Does that make any sense, really? I mean, so that's what I'm getting at, where people, maybe if they don't quite understand what the legal definitions are, they think about it as a dietary supplement. It's like, well, yeah, but that's an herbal product. So they are kind of, people use them a lot of different ways and interchangeably. So anyway, not to get too far in the weeds on this. Herbal products, nutraceuticals is another term that gets thrown around. And again, the definition is there. I don't know why I put it in twice, but there it is. Supplement facts: 50% of people in the U.S. take some form of vitamin or supplement regularly. Close to $30 billion spent annually on supplements, and this number doesn't go down every year; it goes up. Recommendations: just some general things I think are important. A lot of people don't tell their primary care provider that they're on a supplement, so they just think of them as like kind of another category that you only care about what drugs I'm taking. You don't care about the other things. It is somewhat important, so I do ask that, especially when I'm like interviewing people on admission. I'll ask them if they're taking any other over-the-counter things or herbal products or supplements or vitamins, and just see if they say anything, because that sometimes triggers a different response in a person. Whereas you ask them, what medications are you taking? They don't consider those medications. Most don't start based on the advice of a healthcare professional. So believe it or not, some people take advice of family or friends, or do their quote-unquote, my favorite, internet research by a company or a website that purports to be beneficial, that's just trying to sell them something. Dr. Oz, GNC employees who have no healthcare background, etc. So there's lots of bad sources of information out there, is my point. So people think that they're doing something healthy, and that's great. They want to improve themselves. But ultimately, I think some of this is a little misguided. This is a funny article. I won't pull it up here, but if you want to look at it too. The government gets involved occasionally on some of this stuff, but it doesn't have a lot of it doesn't have a lot of power, I should say. So prior to 1994, dietary supplements were regulated by the FDA just like drugs. In 1994, this thing called the DSHEA, or Dietary Supplement Health and Education Act, came out. And it was lobbied heavily by the supplement industry, basically to remove restrictions on supplements and vitamins, so they wouldn't have to be regulated by the FDA specifically. So they said, well, these things aren't really a food or a drug, so yeah, maybe it's correct that they wouldn't be needed to be regulated on. And but they can affect a function of the body. However, the caveat being they cannot be intended to treat, prevent, cure, or diagnose disease. So you always see that on bottles. It says that specifically, and legally they have to put that on the bottle, even though their claims are really misleading as to what they're trying to actually do. So the bottom line is dietary supplements are not FDA approved, and what that means is that pre-market testing and approval is not required. They aren't required to do kinetic studies. They aren't required to do efficacy studies. However, the manufacturer is technically supposed to have information on file to support efficacy claims, but there's no regulatory body that would review this ever. So what's the incentive for them to do a clinical trial that costs a lot of money when they can just sell their product without doing that? So a lot of times we get that case where you have that deregulated system that doesn't have any checks and balances in it, and ultimately you end up with products that could be adulterated, they could be sawdust, they could be something totally different than what it is. And ultimately, at the end of the day, it's not a safe environment. There are some things I'll talk about with that, but that's the bottom line. That's why I get really concerned about these things, because it's like, well, how do you even know what you think you're taking is what it is? Let's say you really want to increase your vitamin D because you're deficient. You live in Minnesota. Great. How do you know what you're taking is actually vitamin D? The thing is, no one has ever tested that product to say it is, or if the company might have, they didn't publish anything on it. And good luck finding out if that actually was true or not. So how do we catch the bad products? There's no good way right now. So it's basically an innocent until proven guilty scenario. So the FDA can act if a product prevents significant or unreasonable risk to consumers. So like some of the dietary pills that came out a while ago with phentermine, some other products in were basically cardiogenic stimulants, and in different guises as herbal products. And so people were having cardiac arrest. There are a couple of cases of cardiac arrest and cardiac arrhythmias with them. So FDA did step in and ban that. Oh, ephedra was the product. There it is. So that was considered an imminent hazard. That doesn't happen all that often. Fortunately, that doesn't happen all that often. But the FDA does have some latitude if they do think something is having a negative effect on society or people's health in general. So why don't they evaluate these products like drugs? The manufacturers aren't benign. They want to make money, and they don't care that the product is effective, basically, is the nitty-gritty. They're going to tell you it is, but at the end of the day, they didn't do clinical trials. And even if they did, they aren't high quality. They're going to be like survey-based data, or like a few hundred people. They aren't going to be big trials like you'd see with the drug company. Now, I'm not saying drug companies are perfect in their trials. I've ragged on them enough throughout this course, I think, but it's a lot better than this system. Anyway, no financial incentive to do so, and the public doesn't demand it. If we all stopped buying supplements because they weren't providing evidence of efficacy associated with them, they would start doing it because they want to sell product. But we don't. We don't care as a society, so they continue to do it, and there's no incentive for them to do anything like that. The flip side of that is there's not really any government funding to do research on this stuff either. No, again, it's like, do you really need to dump a whole bunch of taxpayer money into studying whether garlic has any efficacy in heart failure patients? I don't know. Maybe a university might want to do that as some sort of a doctorate type study, but the government's probably not going to go for that, just because it's low impact and the odds of it likely being effective are really low. So there's not a lot of funding out there, even if they wanted to do some more spreading. So they'd have to fund them themselves. And again, we go back to the original problem. They don't have an incentive to do that. There are some herbal remedies that have some proven benefit, whether they have bodies of evidence that existed before the new act, or they simply have been studied enough that we do understand a little bit of how they work. Europe has a little bit better of a system than we do. They regulate some of their herbal products more like drugs, so they do require some more evidence, so we can look at some of them for studies. But at the end of the day, there's a lot of research gaps. Anything that's, I like to think of it that drug companies are pretty smart when they're trying to figure out what would be a possible molecule to investigate as far as a new drug agent. So if there is an herbal product out there that has some sort of really good impact on, let's say, cholesterol, they're going to try and isolate that and advance that in a laboratory setting versus a product on the market that's an herbal product. It's not going to take the market share away. The drug company will eventually figure it out. So there's always that caveat in mind too. And drug companies do actually employ people who research like herbal remedies and things like that people take in small populations that use things, have used them for years, for generations historically, but they might try and isolate and see if there's a specific compound in there that would be beneficial for a disease. So they are trying to do that. So at the same time, it kind of gives you the question on is there really anything out there that drug companies haven't tapped into as far as something really efficacious? And maybe they don't have money to do that, but still, it's a question that always lingers in my head. All right, so what can they say? Structure and function claims. So something like maintains a healthy urinary tract is appropriate. However, they also have to put this disclaimer on here. A claim that's FDA authorized would be a health claim. So like something you could say reduces the risk of osteoporosis. That means that the FDA actually approved that. So for example, for calcium, you could say reduces the risk of osteoporosis because the FDA would agree that based on the evidence, calcium does reduce that. Now, you can't really say like for cranberry cures a urinary tract infection or rids you of urinary tract infection or whatever. You can't infer that there's some sort of a disease-curing benefit here. So again, reducing the risk of osteoporosis is actually a pretty vague statement, right? So what does that really mean? Everyone's going to develop probably some form of osteoporosis as they get older, osteopenia, and does it reduce the risk? Sure. Again, that doesn't mean a whole lot. And then you can make statements according to nutrient content. So you can say a good source of calcium. So you see that on milk and other things like that, which is approved by the FDA to say. Things you can't say: treats hypertension, controls blood pressure. Interestingly enough, if the name of your medication implies a disease-curing benefit, that's excluded. So for example, this product says cold and flu away, which implies that it cures the cold. That's actually not against FDA labeling, which is funny. Common minor symptoms associated with life stages are not diseases. So you can make a claim for diseases, if you want to put that in quotation marks, kind of like hot flashes, PMS, mild acne, wrinkles, mild memory loss. All those things could be, you could say, improves mild memory loss. You could say something like that and still be within the allowable claim thing. So it's really, there's a lot of fine lines you can walk between a specific statement that's illegal and one that's not. GMP, I don't know if we talked about this earlier this year, but even if we did, basically it's a guidelines to ensure that you're making products that are pure, they're identifiable, they have good quality composition, and their strength is all accounted for. So it's manufacturing guidelines in a lot of different industries, but the pharmaceutical industry uses them as well. And the guidelines ensure that things don't get mixed together and things are tested and there's quality assurance and stability studies and all types of those things. GMP is only recently required for supplements. So until 2007, it wasn't required at all, which is a little bit scary. So you could be making supplements in like somebody's garage, and that was technically okay. 2007, phase in over 3 years based on the number of employees. So larger ones had to phase in GMP earlier. And now technically all supplement companies must follow GMP. But again, who's following up on that? There's not, the FDA has not a lot of people, and this is probably a low fish to fry in their grand scheme of things. What does this prevent? Adulteration of the product. So again, the product getting contaminated with something else during the manufacturing process. Misbranding. So there's a quality assurance on what's being branded on the label is actually what's in there. So if it says 1,000 units of vitamin D, should be 1,000 units plus or minus vitamin D in each pill. Non-standardization as well. So that's a standard uniform looking product that looks the same as it comes out. Now a lot of companies do this well. So I'm not trying to rag on every single vitamin company, but there are some problems with manufacturing out there and misbranding and those types of things. Anyway, we talked about that here. Standardized label claims. So products may be labeled as followed as standardized, which means high potency, certified potency, or guaranteed potency. Again, this doesn't really mean anything. It's just something they put on the label that is a marketing tool. There's no certification behind that. There's no quality standard that anyone follows up on that means that something's high potency. You would hope that what you're taking is what you're taking, right? So why would you need to put that on the label? It's kind of silly. There was this study in 1998 that just looked at St. John's wort products that ranged from 20 to 40% of the label claim from a bunch of reputable brands. And I'll show you something else about that too here in a second. Okay, so are there safe products on the market, and do some of these companies test their products? And the answer is yes, some do. So there is a third party called USP, or United States Pharmacopoeia. USP actually is a group that puts out a bunch of guidelines for how you test things and make sure things are up to a certain quality standard. So for example, I worked at a pharmaceutical lab for a couple summers when I was in college, and I did quality assurance. And what we did was we had all these USP related tests that we had to do to make sure, like for example, volatile organic compounds weren't getting into the product. So we did like HPLC, GC chromatograph assays on them. So that's what USP does, is it has recommendations for certain products and what you need to do to test them. If you pass that USP test, you ensure that it contains ingredients written on the label, contains the amount and strength on the label, and meets requirements for limits on contaminations and compliant with GMP standards. So these things seem pretty straightforward, right? But the reality is very few supplement companies actually do this. There's another product a group called ConsumerLab.com that randomly tests products on a retail level. It does cost money to use, though, for the company. NSF International is an independent nonprofit that tests as well. USP is really the one that is probably the biggest one you'll see in the United States anyway. So I'm not trying to advertise for Nature Made because I really don't care, but Nature Made is one that actually does USP test a lot of their products. Like I know they advertise on TV that they do that, and it's actually true. However, be careful. Not all Nature Made products have a USP seal on them. You'll notice some of them don't have that little mark, and if they don't, they didn't test those specific products to USP standards. So why do they do some and not others? Again, costs, and ultimately they don't really need to. So anyway, there's some things that they might do, but USP is going to be the one that's going to be the most comprehensive as far as if they're following USP guidelines. That's a pretty good. That's what drug companies follow, and you can pretty much guarantee that your fish oil actually has fish oil in it. It's 1,200 milligrams of it. So I always say if somebody's going to take a supplement, they might as well know what they're taking is actually what it is. So that's another little rule of mine I have. Okay, there's this fun investigation in New York a few years ago where they got these, I don't know if consumers were complaining or how it came about, but anyway, the New York Attorney General investigated after some products randomly were taken from New York stores, including GNC, Target, Walgreens, and Walmart. So these weren't like weird, stuff. Well, I shouldn't rag on co-ops too much, but stuff somebody like might have made in their basement that you see at the co-op with like a hand label on it. This was actually like large scale production stuff where you're seeing at like a retailer where you think, well, this is probably a place where they should have legitimate things. They did DNA testing to see what was in there to match it with the plants that were supposed to be represented on there. So that's a little questionable, but that's what they did. And then there was a Canadian study with similar results, basically that showed that most of the products didn't contain any detectable amount of the labeled ingredients. They looked at carrot and legume data was found, and that's actually illegal. So even if you adulterating a product is illegal, especially if you get caught with it, right? So the product might be out there sitting adulterated with other stuff in it other than your fish oil or whatever is in there, or whatever it says it's in there. Might have something else in it, but unless you actually test that, you don't know if it's adulterated. So again, there's no one testing that with supplements, so you don't necessarily know what you're getting when you get them. So again, whether the study and scientific method was perfect, this question still raises that a lot of this wasn't able to be found, the claims. And if you want to look at the article, it's there. So you can see what they actually tested. Oh, what happened? I don't know. Kind of lost track of it. I'm not sure if it got tied up in litigation. The thing is a lot of these companies probably buy their supplements in bulk from the same manufacturers, and they brand them in different packaging, right? So Target brand, Walmart brand, the odds of it coming from the same supplier is probably good. They just like Target doesn't have their own supplement factory. They outsource all that stuff, right? So they probably just point the finger. Well, we just assume they're making our up and up stuff is the right stuff because that's what we signed up for with our contract. So they push it all on the other company, and then it gets probably in legal chaos. So anyway. Talk about ephedrine really quick. Ephedrine is a stimulant similar to a vasopressor. It releases tissue stores of norepinephrine, and in the 90s it was marketed as ephedra, found in a lot of weight loss stimulants, and large number of adverse effects, afforded, again, cardiac effects. We actually use ephedrine. I talked about this with epidurals. They boost blood pressure and keep the baby's heart rate up when if you have an epidural and your baby's heart rate drops. You can actually make methamphetamine out of it too, but anyway, that's another story. So there's a couple other products out there, like this is a DMAA, which is similar to ephedrine. It's a stimulant. It's another banned substance, but identified in a bunch of workout supplements. So people continually find ways to like slightly alter the molecule or rebrand what it actually is, or call it something different and put it in something else. So it just goes to show you that you never really know what you're getting, and a lot of this is really sketchy, and there's just no resources to have a check and balance system with this. So that's, again, it makes me a little nervous with some of these things, especially like the weight loss advertiser, like anything that's for men that's testosterone boosting. I've seen some people come into the hospital actually on some stuff like that with weird symptoms. So I don't know. It makes me a little concerned at because we don't really know ultimately what's really in those products. All right, so why do people use these? Again, there's a lot of legitimate uses, which we're going to talk about here in a second. Again, people want to be healthy, so they want to try and use something. I think it depends if they're trying to be complementary to a medication regimen or alternative. That's up to you to talk to them about. If you think that they could try something alternative versus a pharmaceutical agent that's maybe appropriate in some cases. In some cases, it might be detrimental to their health, and there might be a better pharmaceutical alternative that will be long-term more beneficial for them. One more funny story, or things that I think are funny. There's this product called Prevagen that still exists on the market. It's a synthetic protein, well, they call it the synthetic protein, called apicorin. I'm not sure how to say that. But anyway, it's derived from jellyfish bioluminescence product. Now, why anyone would ever think that this would be something somebody would need to be consumed is my first question. But it's marketed as a brain health memory supplement. It's actually made by a company in Madison. The FDA investigated them in 2012 and found a bunch of violations. They basically found that the way they were marketing it, the way they were processing it, this product's actually a drug. So they're trying to sell it as a memory-enhancing supplement, which isn't correct. You can't do that. And then there's a bunch of claims on their website saying like the first and only dietary supplement that protects brain cells from death. Yeah, they didn't. There's no way they could prove that. So the FTC slammed them with false and unsubstantiated claims. The company recommends 90 days for full effects, which is $100 for a bottle, so it's not cheap stuff. There's a class action lawsuit in 2015 that said it was a protein. It doesn't work. It has undocumented ignored side effects. There's no actual clinical testing. It's actually a drug, not a supplement. However, to this day, you can still get it at most major retailers. So I don't know whatever happened with it or what, if the lawsuit never went through or still pending litigation, but yeah, it just goes to show you that you can have a product out there that's blatantly ignoring current laws and a lot of legal pressure on it, but ultimately it's still selling its product and still being manufactured. So why we don't have more authority to pull stuff like this just directly off the market is totally beyond me, but that's just the case we have. Okay, let's talk about vitamins. All right, so McDonald's plus a multivitamin doesn't equal a balanced diet. It's a joke. Okay. All right, so fat-soluble vitamins, there'll be a test question that'll ask you which one's not a fat-soluble vitamin. So if you know ADEK, you're good to go. All the other ones, so all your vitamin C and all your B vitamins are all water-soluble. Dietary intake, enteric synthesis, and intrinsic synthesis are all types of ways we get vitamins. What are they and why are they important? Vitamins are really important. They're crucial cofactors in a number of metabolic processes. We know for a fact that if you're deficient in certain vitamins, you get problems. So we know that having a balanced diet that gives you the vitamins you need is important for that. So does taking a daily multivitamin matter? It probably depends on your dietary intake, really. Again, I'm not going to get too far into the weeds on this, but if you eat a balanced diet, you probably don't need a multivitamin. If you don't, or if you're malnourished or maybe an alcoholic, and I'm not saying anyone, I'm not talking about people in this room, right? General people. But if you drink a liter of vodka and a 24-pack of beer and that's your diet a day, that's probably not going to give you vitamins, right? So that in those cases, yeah, that might be more helpful than nothing. But time and time studies show that if you supplement vitamins, you don't get the same effects as you do if you get them from dietary sources. Just for whatever reason, and I don't know if it's the salt forms or what we're trying to supplement people with, you just don't. Like all the studies on vitamin D intake, even in deficient patients, they're very inconclusive, and there's very little evidence that says they really impact many disease states at all. And that's because it just doesn't seem to make a difference, even if you're deficient in it, if you're taking a supplement versus if you're actually supplementing it with dietary sources. So again, not entirely sure why, and that's more dietary stuff that I'm not going to go into, but that's the moral of the story. However, is it going to hurt you to take vitamin D? No. So that's the other side of the coin. All right, vitamin A. So vitamin A, retinol or retinoid type products are present in plant carotenoids, so leafy green and yellow vegetables. Things like beta carotene, lycopene, and lutein are all vitamin A. So like if you see eye vitamins specifically, or vitamins specifically formulated for eye health, they'll always have lutein in them usually, or maybe some lycopene too. They're thought to be antioxidants of some kind that protect eye health, but we don't really truly know exactly how they work. They're present in fish, some meats, some dairy products too. They're stored in the liver and fat. Roles, visual pigments, again, lutein has some role in that. The rest of them we aren't really sure. They're a cofactor in some processes. We talked about vitamin A products with respect to acne treatment and the mechanism behind that, so I won't rehash that too much. And that's a little different. Those are prescription products, or some of them are kind of over the counter now, but like Accutane or oral ones are prescription products. Deficiencies do cause blindness and dry eye, which can lead to infection and blindness. And then products, there's a lot of oral supplements out there, and again, the RX or the prescription-only ones are used for acne. Vitamin A, if you want to consider any supplement toxic, vitamin A is the most toxic one. So long-term supplementation of 3 times the recommended daily intake can lead to some issues like bone and muscle pain, skin and hair disorders, liver damage, GI bleeding, and it's particularly problematic for developing fetuses too. So if you have a patient who's pregnant, vitamin A is fine if it's in a multivitamin that's controlled. If they're like tripling up on their vitamin A, that's something you don't want them to do. So that would be probably maybe on the test too, something about vitamin A toxicity. Vitamin D. So I think if there's one thing that everyone comes into the hospital on, it's probably vitamin D, or at least maybe 75% of the people I see in the hospital take vitamin D. Different forms, there's a couple different ones, D2 and D3, ergocalciferol, and vitamin D3, which is cholecalciferol. We talked about this with osteoporosis a little bit, so I'm not going to talk about it too much. Basically, you can get vitamin D3 synthesized via UV light, so UVB light, 10 minutes of exposure is enough to pretty much get your total daily dose of needed vitamin D. It's the only vitamin actually synthesized by the body, which is kind of cool. Calcium plus vitamin D, so remember vitamin D helps us absorb calcium out of the GI tract, so it's important to take both if you're trying to supplement calcium. Clinical role, obviously bone health. Other roles, very theoretical at best. A lot of stuff has been studied with vitamin D. Again, we have large portions of people in the world, like in our state and in Northern Europe and most of Northern America, really. In Canada, you have people who don't get enough exposure to the sun to synthesize vitamin D. So the question is, do they get enough from their dietary sources, or are they supplementing and are they deficient? And do those deficiencies correlate with anything? And then, if you can isolate a deficiency that correlates with if you can isolate a problem that correlates with vitamin D deficiency, does supplementing vitamin D actually help that specific problem? And that's where the evidence never really links up quite. The only thing I've really seen positive evidence for is with depression in adjunct to an SSRI, not by itself. Immune system. So deficiency may increase the risk for infections. Cancer. Maybe some benefit in preventing colorectal cancer, but likely inconsistent. Again, calcium absorption can maybe play a role in that. Cardiovascular, increased blood pressure and CV risk with deficiency. Supplementing doesn't seem to do anything, though. Correlations with deficiency as well. There's a lot of vague stuff out there. Type 1 diabetes, schizophrenia, MS, all cause mortality. So basically, if you're deficient, you just have a higher risk of dying on any given day for a variety of reasons. So anyway, vitamin D has been looked at as kind of like the popular vitamin right now and has been for several years. And again, if you're deficient in it and you're supplementing it, it's not going to hurt you. It's like impossible to overdose on vitamin D. But the odds of preventing cancer with vitamin D supplementation, probably really small. Lots of foods are fortified, so dietary sources might be good if somebody drinks a lot of milk or, I don't know, I'm trying to think of other things. Fish, meats tend to be high in vitamin D too. It depends on their diet, probably. Sun is obviously a catch-22, right? Some exposure is good for vitamin D. A lot can lead to skin cancer risk. Products come as far as dosing. There's a lot of different options out there. You can get 400 units as kind of the common low-dose vitamin D. I think most people I see take 1,000 a day, and that's pretty standard. 5,000 units is the high-dose prescription strength, and that one is usually done once or twice a week. And the point of that is if somebody is deficient, so if you check a level on somebody, it comes back low, you want to supplement them to get them up to a normal level. Usually they'll do a couple months of that 5,000 per week, and then they'll transition them to a once-daily regimen after that. Again, is that effective at doing anything? That the jury's still out on that. But if you really wanted to treat somebody or some patient was adamant about it, it's not going to hurt them, and it might benefit them in some cases, especially for maybe some mental health conditions. Toxicity, minimal. Again, you can take a lot of vitamin D and really not get toxic at all. You can't get too much vitamin D from the sun. Eventually your body will just stop making it. Hypercalcemia, GI side effects, maybe, but probably not. All right, vitamin E. Vitamin E are tocopherols. Their role is to protect cell membranes and oxidation and destruction, scavenge free radicals, deficiency. People thought that people with deficient vitamin D were having CV events, but none of the evidence ever panned out. And vitamin D is pretty abundant in the diet, so most people aren't deficient to begin with anyway. So there's not a lot of health benefits that I know of for vitamin D. Also not a lot of toxicity. Normal doses are safe for most people. There was a meta-analysis that showed people taking higher than 400 units per day which is a decent sized dose, had increase in all-cause mortality. Again, is that a real strong study? Probably not, but probably a good reason not to overdo the vitamin D, though, just to be on the safe side. Vitamin E is often in AREDS formulation vitamins. These are eye-specific health formulations. I mentioned those during the glaucoma lecture a while ago. Some studies maybe show that vitamin E might slow Alzheimer's progression, but that's definitely preliminary and very early, and may protect against tardive dyskinesia for people on antipsychotics. But again, that's not very well proven either. Vitamin K, we talked about this with respect to warfarin. I don't have much else to say about that. It synthesizes clotting factors. Leafy green vegetables is the one to remember with it. Toxicity is pretty minimal. If you take a lot of it, your body's not going to just start cranking up clotting factor production. It will just use what it has available to it. Vitamin C. Ascorbic acid is the scientific name of this. It's associated, I think, of like pirates and scurvy, people who didn't get fruit or vegetables. It's not very common. I don't think people get scurvy much anymore, but I guess it's possible if you live in a malnourished part of the world, or maybe you got stranded on a desert island, or desert island probably not, but stranded on a boat for a while maybe. Reducing agent for biological processes involving copper and iron. So again, it's a cofactor. It has to do with prostaglandin metabolisms as well. Vitamin C, as far as I can tell, has no real role in treating anything. There's no evidence that supports that it does anything. So I think a lot of people think that there's this correlation with preventing colds, things like that. There was a study that was somewhat cited that if you are exposed to brief periods of physical stress and you take a lot of vitamin C, you may have a slightly lower risk of catching a virus of some kind. But again, it wasn't substantial enough that I think everyone needs to do it. However, that's what it's heavily marketed as, an immune support agent, right? So like you've got a product like Airborne, which is essentially a bubbly fizzy tablet that's full of vitamin C that you put in water. And it was created by a school teacher, which should make everyone nervous because, no offense to school teachers, but like if I told you I was making drugs, and would that be any beneficial? I don't know. I don't think so.
What are you making?
Depends what I'm making, I guess.
You have Walter White?
Yeah. I cranked up this scheme in my basement. Would you take it? Yeah. So anyway, it's just silly. I mean, there's no evidence that Airborne does anything whatsoever. So, but if it makes you feel better when you're on an airplane, it probably tastes good. So go for it. Toxicity. Yeah, artificial sweeteners. No real toxicity associated with vitamin E. Or vitamin C. Vitamin C is in like every fruit and vegetable. There's lots of it. Eat a little, like eating one apple a day is probably enough. Again, I don't want to get in the nutrition side, but like a small amount of fruit is probably plenty for the majority of us. And vitamin C, if you do too much, you'll just pee it out. It's water soluble. So taking a huge, like if you see the things that are advertised, you look at the daily recommended, it's like 1,000%. All of that's just getting urinated out. You're not using it for anything. So yeah, it's a little silly. Vitamin B1. Thiamine is vitamin B1. This one's actually really important for alcoholic patients. So we talked about this a little bit during psych. I touched on it. However, it's the first one to get depleted. So that's another really important factor with thiamine, is that if you're replacing vitamins in somebody who's malnourished, thiamine's the first one you think of. So that's why people come into the ER who are malnourished or alcoholics are always going to get thiamine. They're also going to get folic acid, but that's a separate conversation. So what happens with thiamine? Deficiency chronically can cause something called beriberi, which I've got some of the symptoms here. But what I'm more interested in is Wernicke-Korsakoff, which is an encephalopathy that leads to Korsakoff syndrome, or Wernicke's encephalopathy, I'm sorry, leads to Korsakoff syndrome. And that's from vitamin B1 deficiency. Easily prevented with thiamine supplementation. So that's actually a really good use of thiamine. It seems to work quite well for those patients. However, it is still a risk. If somebody's been malnourished for a long time, you might not be able to undo the damage with thiamine. That's just going to be, it's a neurologic toxicity at that point, and there's not really coming back from that. You can try. You can load somebody up with a lot of thiamine, but it might not work. B2, riboflavin. Not much to say here. I'm actually going to skip this because I don't really have anything to say about it. B3 is niacin. Niacin has a lot of different roles. I think we talked about niacin with respect to a couple things, mostly cholesterol management. So vitamin D3 or niacin is used to lower cholesterol in some cases, but again, it's kind of taken a back seat to statins. Talk about flushing with pharmacologic doses for cholesterol management. Usually the over-the-counter stuff, if you buy like vitamin D3 in a Nature Made, it's not gonna cause flushing. It's not gonna be high enough dose or potent enough to do that. It's mostly the pharmacologic ones, or the pharmaceutical grade ones. Some other B1s, B6, again, it's a cofactor. None of these are really toxic in overdose. They're all going to be urinated out if you have too much of them. We talked about pyridoxine with nausea and vomiting. Remember, it's mixed with doxylamine as a category A option. Evidence isn't great for it, but again, it's benign, so might as well give it a shot. B12 and folic acid, we talked about that with anemia, so I'll just refer back to that lecture if you're curious. I don't really want you to rehash. I won't rehash anything about B12 or folic acid on the exam. Don't worry about it. We already talked about it. You'll see a lot of vitamins marketed as B complex, which is like every B in multiple quantities. So it's usually going to have all this stuff in it. You can't, one of the only restrictions that I know of as far as doses, you can't, well, vitamin D has the 50,000 that's prescription only. But for folic acid, one of the differences between a prescription prenatal and a over-the-counter prenatal is the folic acid. So they recommend getting at least 800 micrograms of folic acid a day, and a prescription product has 1 milligram in it. You can get up to 800 over-the-counter, though, so it just depends on what people want. Either one's probably fine. I think with that, there is pretty good evidence that folic acid supplementation does have a pretty strong, or if you have a folic acid deficiency during pregnancy, you do have higher risk for, gosh, why am I blanking on what happens? Somebody help me out here. What happens if you don't have folic acid? It's the
Neural tube?
Yes. Yeah, spina bifida. Thank you. I could picture it in my head what it looks like, but anyway. So in that case, I think people tend to veer towards prescription products because you know that you're getting one milligram of folic acid every day versus something that may or may not have folic acid in it. Personal preference. All right. Okay, herbal, non-herbal products. Really quickly, just talking about some of the types of complementary alternative medicines out there. You have, most of these are biologically based with some sort of idea behind how they work, but they're substances found in nature, so a lot of times it's confounding which compound is actually doing anything. As far as complementary alternative medicine, the concept of whole medical system, so based on the body healing itself, homeopathy and naturopathic medicine kind of fall under this umbrella too, although I think of like herbal products and homeopathy is very different, and I'll talk about what the difference is here in a minute. And then there's some other things too, like manipulation, body-based practices. So I think of like, acupuncture, chiropractic, massage therapy. Obviously, those are all very different things, but they can all be kind of considered complementary to our current practices, more of our Western medicine, if you will. Okay, a fun quiz. So what patients are most likely to use an herbal supplement, women or men? Women, yeah, that's correct. Over 45 or under 45? Over, correct. Caucasian or other ethnicities? Correct. East or West Coast? Should be an easy one. West Coast. College or no college? College, yeah. Okay. That's right.
The richest.
People with no college can afford them. Sales. Most sales occur outside of pharmacy or standard retail, so internet shopping, TV shopping, natural or health food stores. So the point in me putting that on there is most people don't have access to somebody who actually has medical training or a healthcare background to talk to about why they should be taking these things. This is really old data, so I don't even know why I included it anymore, because I bet if you polled people now, fish oil is probably #1 for sure. But anyway, this was an old study about percentages of people taking, and 20% of people surveyed said they use more than 4 products. I think that's not uncommon. Usually, if I see people in the hospital who are taking something herbal, they're usually on multiple herbal things. All right, let's talk about some of the herbal products that I don't think these are necessarily the most common, but they're more of the ones that have a strong correlation to treating a certain disease. Whether they work or not is another story. Black cohosh has similar effects to estrogen. Its full mechanism is not totally well understood, but actually it does have some evidence for producing a modest reduction in hot flashes, but hasn't been shown maybe to be long-term. It seems like it works short-term, but not carries through. But maybe enough to get somebody through some mild vasomotor symptoms during menopause. Side effects: mild GI, breast tenderness, vaginal spotting, bleeding, kind of what you expect with an estrogen-like analog, which is basically what it is. Considerations: avoid in pregnancy breastfeeding. I'm not sure why you would take this if you're pregnant and breastfeeding, because it's really a perimenopausal drug, but that on there. Active breast cancer, probably not the best drug to take, and it does inhibit some CYP enzymes. One thing to remember about pretty much all herbal products is they all like to interfere with drug enzymes. So if you have drugs that are metabolized heavily through the cytochrome P450 system, herbal products probably aren't going to be compatible with that person's regimen. So that's another reason to ask, especially again if you have something that's you got to be careful with, like a transplant medication would be a good example. Cranberry. Cranberry theoretically prevents adhesion of bacterial cells lining the urinary tract. It's actually shown to work, but only if you take it really specifically. So you actually have to consume 10 ounces of pure cranberry juice every day, and that might prevent UTIs in young and older women. The problem is people don't always tolerate. I don't know if anybody ever tried straight cranberry juice. It's really sour. It's just not cranberry cocktail. It's mostly sugar. That doesn't work. It's not this. It's not going to give you the same benefit. So anyway, people get GI upset. Kidney stones can be caused if you drink a ton of it, which I don't know who could stomach that much cranberry juice a day, but it's possible, I suppose. Considerations: capsules, the capsule products like the Azo Track or whatever that brand is, those aren't as effective as pure juice. And just remember that pure cranberry juice is actually really low in sugar, but if they're drinking cocktail or something else, it's going to be bad for like a diabetic patient, or it's just going to be extra calories, like drinking soda, right? Cranberry juice contains salicylate, so if you're aspirin allergic, you might actually get some allergic response to cranberry. Cranberry also may inhibit warfarin therapies, especially if you're drinking it every day. It does inhibit CYP2C9, so warfarin would be the big one I'd be concerned about with there. So if you have a patient on warfarin, cranberry is one of those things I ask about. So especially if it's an older lady, not to stereotype, but they seem to be the ones more likely to do the cranberry juice thing. Echinacea, cytokine, and white blood cell production may boost immune system. People take this to prevent common colds or shorten the duration. There's no evidence that it really does anything. However, there's some studies that show that you might get a couple of days of relief from it. Again, it's hit or miss on the body of evidence we have. Does inhibit some enzymes and induces some enzyme as well. So there's that. Garlic is an unknown mechanism. Out of all these, garlic doesn't really have any benefit that I could figure out based on studies. So there's no evidence that says garlic does anything beneficial for the body. Very small reductions in blood pressure. It's been studied for a lot of different cardiovascular things like cholesterol and blood pressure, but 2 to 5% reduction in blood pressure isn't clinically significant, and it doesn't really have any effect on cholesterol. So people take this for a variety of reasons, but there's not really any benefit to it that I can see, at least that evidence has shown us so far. Ginkgo. Ginkgo is a possible free radical scavenger that people market for memory improvement. There was some studies that showed positive effects on memory and speed of cognitive function. However, if you were elderly or already had dementia starting, it was less beneficial, if not beneficial at all. So for somebody younger, maybe, I don't know, maybe acts kind of like a stimulant perhaps, but other than that, it doesn't really have much of an effect. It can inhibit platelet aggregation too, so be careful with people on aspirin or other things that would interfere with the clotting process. Oh, there it is. Ginseng, used for stress relief. This seems to be in a lot of different juices and things like that. There's not really a lot of good evidence for any of these things working. The one thing that there's some studies for is improved mental performance and actually erectile dysfunction, believe it or not. But it is a mild stimulant, so that might explain that. Side effects, insomnia, which also makes sense given it's kind of a stimulant. So again, you see it put in energy drinks and things like that for that reason. Saw palmetto, inhibit production of dihydrotestosterone and block hormonal uptake by the prostate, on the side effect there. So BPH is, sometimes they use this to treat it as an alternative. It's most studies, there is a pretty good study that showed no benefit, but there's some smaller studies that showed it was favorable to kind of our standard BPH meds. I think most people agree that saw palmetto is a step below what we have to offer pharmacologically, so that's all I'll really say about that. You wouldn't give this in women and children, but I don't know why a woman or a child would take this, but it would have anti-estrogen effects if you did, so you would avoid it in those patient population. St. John's wort, talked about this very briefly during the depression lecture for mild moderate depression. Some effects may be more effective than placebo, but again, you're talking about very mild cases. Anything more than like a moderate depression, you're probably going to want to treat more aggressively. This drug I think of as being the worst when it comes to drug interactions. It's a heavy inducer. So if somebody's not on anything and they have mild depression, they want to try it, that's probably your ideal patient for St. John's wort. If somebody is on several other drugs, especially like heart meds or something like that, that's not going to be a good mix for them. Valerian root. Valerian root may modulate GABA. It's used for insomnia and anxiety. It's actually been studied, and some studies will show it improves sleep quality to a certain extent, but it takes about 4 weeks to see the effect. So I don't know if anyone's going to give it the full 4 weeks to really get the benefit. It is somewhat of a sedative, so you can avoid it with alcohol. Pregnancy and lactation, it's not recommended as a sleep aid. I think people are always looking for sleep alternatives for pregnant patients. This would not be one I'd recommend, even though it's herbal and natural by some standards. Other sedating medications, so any benzodiazepines, any sleep drugs, don't combine it with them. It seems to work kind of similarly to them. It has some weak GABA potentiation. CoQ10. CoQ10 is not an herb, but it is something people take as an antioxidant, usually for general heart health. So it's been studied all over the place in cardiovascular medicine and CHF. So some studies will show it has mild improvements in CHF symptoms. Some people say it has mild antihypertensive effects. It's been studied for migraine frequency as a statin supplement. There's this thing out there that, well, actually, statins do decrease. The body makes ubiquinone endogenously, so it's not like you won't make this on your own. So some people supplement it because they believe that statins wipe out the body's ability to make this, and that's maybe partially true. There's some good science behind that. However, the problem is that supplementing ubiquinone hasn't been shown to improve statin side effects at all. So some people theorize that statins and their muscle pain related side effects related to this particular deficiency, but supplementing doesn't seem to do anything. So why, I don't know. Again, it could be the whole dietary thing just doesn't work as well as the endogenous processes. I'm not going to talk about any of those, don't really care. Omega-3, probably the most popular supplement out there next to vitamin D. A lot of people take some sort of fish, krill, or flaxseed oil, used for cholesterol management, general heart health, psychiatric disorders. Some people think it has anti-inflammatory effects. This is another one, kind of like vitamin D in Minnesota. A lot of people are deficient, especially in the wintertime. Most people don't eat enough fish to get omega-3, and there's not a lot of other dietary sources of omega-3 out there that people consume regularly. There's some grains and things like that have dietary omega-3, but overall it's hard to get enough. But again, does that really matter? We've seen the majority of evidence out there that I've seen doesn't say there's really any evidence that points to benefit for supplementing it. But again, a lot of people do it because they're probably deficient and there's no real risk to doing it. You can't overdo fish oil. So again, it's sort of like if you want to, go for it, but it's not. I don't think you would. You don't want to sell it as a replacement for certain things. Okay, so effective, moderately effective for at least one indication. These 6 supplements all have some evidence showing that they may be moderately effective for at least one disease. Garlic doesn't really have anything effective that I can find. Mixed evidence would be those where they have some body that say they're good, some that don't support their use. So there you go. That might be handy on an exam to know those ones. Just feeding you guys the answers right now. Shame on me. All right, 2 slides left. Okay, nutrition and antioxidants. So again, I said I wasn't going to talk about this, so why do I keep talking about it? Well, the first 2 years I did this, I put out like an open email saying like, send me stuff if you want me to talk about certain supplements. I stopped doing that because people were sending me the weirdest stuff, and a lot of it was nutrition. Like, what about coconut water? I'm like, how do I know what coconut water does? First of all, there's no evidence. Like, no one studies placebo-controlled coconut water versus regular water, right? No one does that because no one really cares. Coconut water. Anyway, we talked about antioxidants and their role. So certainly antioxidants are important, and most vitamins have antioxidant roles. So they can prevent cells and DNA from damage via circulating free radicals and kind of scavenging for those. And that is an important part of maintaining healthy DNA replication in the body. So vitamins are good. Is there a clinically quantifiable amount of antioxidants we need on a daily basis that would prevent things like heart disease and cancer? No. No one's been able to figure that out. So if you're pounding pomegranate juice because you think you're going to prevent cancer, hate to break it to you, but there's no real evidence that says that does any benefit for you. There's a lot of foods out there that, again, have really widely lauded benefits, like soup. I hate when people use the term superfood. It's like, what happened to foods that aren't super, right? Like an apple. Turns out most things we eat that are not pomegranate or whatever the trendiest fruit is now actually have really good quantities of vitamins and antioxidants in them. So again, it's all about. And I'm taking this from dietary people who've talked to me, so this is kind of me speaking through them. But balanced diets, fruits and vegetables. You don't need to get fancy or exotic with them. Like the stuff you can find that you like is probably just fine for the majority of people. So anyway, that's my take on antioxidants, and that'll cover all your questions, I'm sure. All right, some other stuff. So the sky's really the limit. I handpicked a few of these things out there. There's so many things that people can take, that people take for various reasons, and it gets really bizarre. I think, oh, you know what? I kind of glossed over this quickly. Let me just go back to this link for a second. Natural Medicines Database is a really good reference for this kind of stuff. So when you get that patient, inevitably you'll get a patient who takes a lot of different supplements, and you're like, why are they taking this? And then the bigger question is, they're in your ER, urgent care, or family practice, or wherever you're practicing, and they're presenting with some sort of odd complaint that you can't pinpoint on anything, and they're on 5 supplements or 5 dietary products. So the question is, can any of those cause this whatever thing that's going on? So Natural Medicines Database actually has a pretty good, granted there's not a lot of evidence out there to begin with, but they do have a lot of the stuff that is out there, at least compiled in one place. It does require a subscription, I believe, but a lot of health systems like ours subscribes to it because it's really the only source like that out there. If you search this stuff in UpToDate or Micromedics, you're just not going to get a lot of the information for why people take it, what kind of common side effects there are with it. So again, I'll just put in a plug for that one. It's helped me out a lot with answering some of those questions. The majority of the time it's no, the supplements weren't causing the problem, or probably not, but you never know. Every once in a while you find something that strikes you as odd. Oh, and then homeopathic. So I just wanted to put homeopathic definition up here because I think people interchange herbal products and homeopathic regimen. Homeopathy is very bizarre. If you've never read into it, you could look on Wikipedia or something like that. But basically, the core conventions of it that like cures like. So that means that the notion that a disease can be cured by a substance that produces similar symptoms in healthy people. So for example, if you have high blood pressure, and if I give myself a stimulant and it increases my blood pressure, I could give you a stimulant and it will decrease your blood pressure. It makes no sense. It's physiologically impossible. But that's one of the foundations of it. The other one is the law of minimum dose, that the notion that the lower the dose of the medication, the greater its effectiveness, which again violates a number of scientific laws and principles and pretty much everything all of us were taught in chemistry and physics, etc. So homeopathy, just know that that's very, very different than herbal products. So again, they get confused as the same thing, but homeopathy is essentially water. They dilute their products so low because they believe that a lower dose is going to be more effective to the point where it's almost untraceable in the product itself. So anyway, has it been studied? Yes. Is there any evidence behind it? No. So that's all I've got for you. You guys have any questions? Any random supplements you want me to answer? I probably won't be very helpful, but I can certainly try.